Democratic Club. Tonight, we'll begin in a few moments with panelist introductions. We might have a third panelist show up as we get into the program. If she does, we'll allow her to introduce herself also. After that, we'll begin with some questions. We'll take questions for approximately an hour. You have index cards on your tables if you want to submit those. I do have some that have been submitted already, and we'll start with one of those, or you can raise your hand and I'll call on you. I think I know about 75% of the folks that are here this evening. Keep in mind that this is it's an open format, but not a debate. We're just here to share information. If you have questions, again, use the cards or raise your hand. If you don't know, there is water at the door if you'd like a bottle of water, and the restrooms are out the door and down to the right. If you go to the left and go to those restrooms, I've been informed you won't be able to get back in. So don't go use the restrooms to the left. All right. We're going to try to also pass the microphone, so bear with me here. And we will start with introductions.
Hi, my name is Kathy Ellis, and I'm running for Congress in the 8th District. I ran in 2018, and I'm back again. I live in Festus, Missouri, and grew up in House Springs. So I've been a Jefferson County girl all of my life. And I noticed we're supposed to talk about a little bit about our educational employment. I graduated from the University of Missouri St. Louis and Washington University for my master's degree in social work. And I've been a clinical social worker and an addiction and trauma counselor for well over 30 years. So I'm new to politics, and one of the things that I find is that there are a lot of similarities between being a public servant and being a social worker. One of the things that we do is we listen, we help people solve problems, and at the end of the day, when those problems get solved and quality of life improves, then people have empowered themselves. So as you are here today, you are experiencing an act of empowerment. You're coming with your questions, and I'm sure a lot of people have personal experiences they might want to share, and that is extremely helpful to me, and I know to our panel, to everyone around us. So thank you for being here. I have, as I've said, I've been a social worker for many years. I started out working with some youth groups in the inner city. I've worked as a residence director of a women's halfway house. I've worked in inpatient addiction treatment for a number of years, and I've also done a lot of volunteering in addition to what I do professionally, just to work with people that may feel disenfranchised in some manner for some reason. And so I also serve on the board of the Community Health Center. I'm the vice chair of that board, and on a domestic violence board. So I really appreciate being here tonight. Welcome, and I think we'll learn things.
All right, I don't have near that kind of resume. I'm Stephanie Shank, and I'm the administrator of the St. Genevieve Care Center. I've been in that position for 21 years and in long-term care almost 30. And so I'm here tonight to address any questions you may have regarding Social Security, Medicare, Medicaid, long-term care insurance, those kind of things, if you have those questions.
Thank you, ladies. I think if you have cards, you can certainly bring them up, or Joan and Elaine will collect them and bring them up, or raise your hand. But we'll start with a question I think a lot of folks have. It's at the top of my list. States, I'm concerned about getting by on Social Security. Annual benefit increases simply don't keep up with inflation. The increase in my Social Security check last year did not keep up with the increase I had to pay in Medicare for my Medicare. How are retirees supposed to deal with this?
Well, in the general community, I don't quite know the answer to that, what people need to do to continue to live in their homes. When it comes to long-term care, though, one thing I can say is that having a good supplement, which I know is often costly, we always suggest that people get the Plan F. It covers the majority of things in the facility that the patient may need. Related to Medicare, you have to have a 3 midnight hospital stay for your Medicare benefits to even play a part of payment in the nursing home. That only pays 100% for the first 20 days of your stay. On the 21st day, Medicare pays 80% of your bill, and then the other 20 either has to be covered by a supplement, or you have to pay that co-payment amount out of pocket. I think right now the co-payment amount is $168. So you would still, even though you had a Medicare benefit, if you don't have a good supplement, then you're still going to be paying out of pocket for your Medicare A stay. How it affects, it doesn't really affect the nursing home in any other way. But I would say if you're basically living on that Social Security, and a lot of people go with a managed care plan instead of a supplement, a Medicare and a supplement. And as far as that, it's much, much cheaper. And if you can maybe save up some cash while you're making that savings in the community, you can earmark that money for medical expenses, and then maybe have a little reserve if you need that, if you need skilled care, especially short-term rehab.
Can you clarify, what does that mean? If you have, I have Plan G, which to me has all the benefits of Plan F, except I think I have 180 deductible, but the monthly payment is so much less. It makes sense to me to have the Plan G. But on Medicaid, what I didn't understand about your answer is, if you have to go into a nursing home, what does what do they call them, HMOs, are they as good as having the good supplemental?
Sometimes they are, and I can't name call of all the ones that we have at the facility, like United Healthcare, Coventry, all those. Typically what we do is have to negotiate a rate with the insurance companies, so they don't pay as well for a stay, and so you might not get some of the benefits because that insurance doesn't cover certain medications or certain therapies, or your length of stay is very much maybe compromised because we have to get a confirmation like every 7 days, and we have to send the HMOs and managed care plans like a lot of paperwork saying what your progression is, and a lot of times we feel that they kick patients out way earlier than in a Medicare plan, where our medical team gets to determine, along with families and residents, how much the length of stay needs to be. And so poorer plans, cheaper plans are really more persnickety on how long they'll let you stay for rehab in a facility.
I just wanted to thank you for, you have this level of expertise and this detail that I think that we're really, wanting to hear about. I know I am. I want to just thank you for these explanations because they're extremely helpful. Just a comment, I know that when my dad was looking at Social Security, different policies, supplemental policies, he did a tremendous amount of research, and he had been the chief financial officer of school district in Jefferson County. And so he sort of had a better grasp of the insurance, and even that, I think he found it to be pretty overwhelming. And he finally found a plan that I think worked exceptionally well for him since he had some severe illnesses. And so that's one of the things that I learned from that, is that you have to take the time and do the investigation of whatever supplemental plan there is to make sure that that covers your own particular needs. So that's my 2 cents about this. I'll hand this back to the expert.
I have a question.
Yes, Lisa.
So when you talk about the different companies that provide these supplement insurances, if you choose a certain supplement like Plan F or Plan G, the coverages, I understand, or at least I thought, were set by the government, and it's only the price that varies from company to company. Is that not correct?
I really don't know the answer to that. People come with their supplements already purchased when they get to me, and all I can do is make the phone call to the company and ask, do they cover?
Well,
You know?
maybe someone sitting here can correct me if I'm wrong, but I believe that the government sets those terms in each one of those letter categories, and the prices may vary from company to company. Elaine, do you?
Yeah, they do, because when I retired, however many years ago it was, and I'm neurotic, as anybody knows who knows me. I mean, I poured over those government things, and there are still things, particularly with regard to prescription plans, I don't get. But by definition, for the government's purposes, you have like Plan A, B, C, D, E, F, G, a lot of them. And yes, each company has to provide whatever that plan, which I assume is set by the government, maybe in conjunction with insurance companies, that they have to provide all of those services. It is, in fact, the price that you pay that depends. And on the government side, you go on, SSS.gov, Social Security site, and then they take you to Medicare. They also rate the plans. They have really good charts online. And if I'm preaching to the choir, I'll stop. But they will show you like different numbers. I guess it's people satisfaction. They rate them all. So it helps you decide which one is best. And yes, you're right. And I'd actually heard at one point they were going to do away with F plan and everybody would be on G, which is different from F in that you have to pay a deductible, and I think it's the amount you pay for Social Security. And again, I have Mutual of Omaha. And when I compare that extra little deductible I have to pay to Mutual of Omaha's F plan, where I wouldn't have to pay that deductible, I still come out ahead when I, do the math.
Other audience questions?
I probably don't need a microphone.
That's okay.
No loud voice.
If not, we'll kind of jump to a different type of question. I know my grandmother would have loved to have had this answer years ago, because I am helping her make some of those decisions now. But what resources are available to help my parents plan for their likely transition to assisted living and maybe eventually a nursing home?
I'm sorry, would you read that one more time?
What resources are available to help my parents plan for their likely transition to assisted living or perhaps even a nursing home?
Okay. Well, there's lots of websites these days that give good information. Aging Matters out of Cape Girardeau has a great website that tells you the questions to ask the facilities when you do make those calls. We do now go by a star rating, and on Medicare.gov you can compare nursing homes in your area. They cover things like staffing levels, survey results from that state and federal surveys that we go through, quality indicators, which is all kinds of, we have to do what's called a minimum data set. And so each resident has an MDS, and one of our nurses, her responsibility is to fill this 50-something page document out on a quarterly basis, and the government takes that data, and then we're rated on wound care and just everything from A to Z related to patient care. And based on all your results, then you get a star rating from 1 to 5, 1 meaning poor and 5 meaning the best. And so it's a little bit subjective, and I don't always think the results are correct because I know some really, in my opinion, very good nursing homes that have a real star rating. Sometimes you have to have a real smart person behind the computer doing things correctly so that your results show up correctly, and sometimes that doesn't happen right. I know one time on our staffing, the government has another document called PDJ that we have to do, and we were doing some things incorrectly as far as coding our staffing. And we came back with like a 1 star in staffing, and we were all in a panic. And for a whole quarter that had to stay until they took our next set of data, and we got it done correctly, learned where we were fouling up within that system. I always suggest going to the facilities, talking to the staff, the social worker, the administrator, getting a tour, talking to family members that you know in the community that have already gone through it. It is a maze and hard to maneuver through all the Medicare, Medicaid, all those things. So yes, just visiting. I think most people, and I know there's people in here that have loved ones in, you get a feel for a facility when you walk in it, you know. You can feel a vibe, and each one is very different from another, and some fit others' personalities better than others.
You know, one of the things that just the overview of this is that it seems very, very complex to try to find any information out. And you know, I think that one of the best things that we can do from the governmental level is how do we make this simpler? How do we get the coverage that we need, yet have access to someone who that's all they do is answer questions about how you're going to be impacted if you use this particular kind of a policy or whatever. We can go to the computer and we can go on different websites, but somehow I think it's better to have the interface of a human being that's telling you the information. So one of the things that I think it's important, if we're looking at Social Security, if we're looking at Medicare, that we make that something that is user-friendly, so that it doesn't become this huge thing that we have to do this, you know, momentous research over to try to find out very simple answers. I know that in the St. Louis area, Rich Grauer, who was the coach for the SLU basketball team, is the guy to go to for finding out information about Social Security and Medicare. It's sort of his retirement position is to know as much as he can know and help as many people as he could know. He would certainly be, I'm sure, open to coming down here to another forum where you could ask some questions from him. I know he was extremely helpful with my mother as she started to navigate Social Security. So that's one thing to think about. The other thing is I have been on the sort of the other side of Social Security and dealing with the disability aspect of it. And throughout the course of my career, I've had to write many, many, many letters and in support of someone receiving disability from a mental illness. And that's a very challenging thing, and I think it's far too complicated, but the reality of it is you can, if you have a mental disability, and even if you have a physical disability, it can take you 3 or 4 years to get anywhere in the system. Instead of getting the benefits that you need, you have to hire an attorney and you have to go through all of that stuff. I don't think that we need to do that. I think we need to have people who can be advocates that can help move those things along. So I'm looking at, you know, how we can live our lives better, yet without all of the complication that we have to go through just to get basic services.
I have a question for Stephanie.
Yes.
I Googled it because I didn't know what you were talking about, but is there I'm in Jefferson County, and the program you talked about isn't in Jefferson County. Is there something like that in Jefferson County?
Yes,
Is it with
the aging, there's, I don't know, in the state of Missouri, I think like 7 districts, and each of the districts have an aging matters. It used to be called the Area Agency on Aging.
Okay.
And they've changed their name to Aging Matters now. But they're a wealth of information. They have all kinds of different programs. They even have a specialist in Medicare and Medicaid that they'll sit down with you. They have people that'll help you with your taxes. They sponsor the Meals on Wheels program in the local nutrition centers. They work with transportation. They work with in-home services. They're just, as far as aging, they're the place to go if you need answers for things.
Any other audience question right now?
I have a question.
Yes, ma'am.
I know a young man in his 20s who has been getting SSI while living with his mother. His mother is now turning 65 and going to go on Social Security and Medicare herself. And they told her that he can no longer get SSI. He has to requalify as an adult disabled child under the Medicare program. Do you know anything about that? Could he be totally kicked off and not be able to get anything if he has to start all over? And he's a mental health patient also.
Does he have a psychiatrist?
No, not right now. His psychiatrist died.
Okay, so a psychiatrist is the key to this whole process. And because the psychiatrist, it has the final word about, what level of help is needed. And I, as a therapist, I gave the documentation that, also, kind of asserted what the psychiatrist was saying, because I would usually be the person that saw the person more than the psychiatrist did. But that's a real key, is to find someone that would do that. Where do you live? What area?
Well, this would be in St. Charles.
Okay. Yeah, you might want to check to see if they're in any of the health centers that they have up there, that they do have a psychiatrist that you can go to, and it should be, at no cost, just to get an appointment.
Okay. Thank you.
Any other questions from the audience right now? All right, we talked a little bit about resources, and a little bit of your answers came back as far as the folks that are there to help. But there are some other organizations, and I have a question related to that. I receive a lot of junk mail. Does it really do any good to sign petitions to our elected senators and representatives, say from the Seniors Coalition or the Coalition to Save Social Security?
Well, I think a phone call is the very best thing that you could do, in addition to actually going and talking specifically to the elected officials to find out what their positions are, and to state what your demands are and what your needs are. I think that's the very best thing that we can do. It's been my observation that you can do a whole lot of petitions and go through a lot of time and energy, and it probably just gets filed. So a direct contact, phone contact, some people, call their representatives daily just to say, what are you doing about this? What are you doing about this? That's the way that I think you need to approach it.
We're talking about state or federal? Everybody.
Any audience questions? I'll keep asking that. Change track a little bit. We'll come back. I've got quite a few cards here. I appreciate that. And both could answer, but Kathy, what policies or what is being done on the federal level in regards to Social Security that could potentially help us?
I'm glad you asked that question. I have a little bit of research here. There is a bill that was put out in January of 2019 called the Social Security 2100 Act, HR 860, and I think you may have some copies of that. Okay. So this is the first draft of this particular bill, And it really looks at a lot of different things. And, you know, one of the things that I think that has happened in Congress is that they've been kicking the can down the road for a really long time in dealing with Social Security and you know, keeping it solvent. And so I think that one of the things that needs to happen is we need to get rid of this gridlock in some manner and start to make some moves forward. I think that, you know, in my opinion, Social Security is one of the things that has safeguarded so many individuals over so many years that it needs to be protected. And some of the policies here, and this is, you know, when you see one of these bills that's introduced, you know that it's going to undergo so much change as it finally creeps along. But apparently this is now, it's in a subcommittee. So that's a little bit of movement, and it'll get referred back to the full committee. But, you know, there are some things on here that I think that are important to mention. For example, it increases the benefits to old age survivors and disability insurance. And but it also talks about how they want to strengthen the trust fund that pays out to the Social Security system. The biggest thing I think that is going to be helpful is with the payroll taxes. They're not collected on wages over $132,000 or $132,900. And the legislation would apply the payroll tax to wages above $400,000. So it would only affect the top 0.4% of people, but it would benefit greatly. When you're talking about raising some of the taxes on everyone who collects Social Security and all of our, you know, payroll taxes, it's about a 50% or 50-cent increase per week per person. So there's a total there that would actually really help to give us the care that we need more through Social Security. I think that that 50 cents per week would be, you know, definitely something that's worth it, because I think we benefit greatly from that. So I'm following this bill, and I think that, you know, as we know, there's a whole bunch of steps you'd have to go to before it finally even passes out of the House. But that's one of the things I would certainly encourage your legislators on the federal level to do, is to make sure that there is some progress, that people are at least talking about this. And of course, you know, this originated in the House. The Senate, who knows what they would do with it, but you know, at least it's a little bit of movement forward. So I would encourage you, if you don't have a copy of this, we can get a copy to you, and you know, read this through and see if that's something that meets what your needs are and what your expectations are.
You know, I'm surprised that all these years later that we're just having this conversation. I remember when I was in college in the 80s studying gerontology, and all the classes I would take, they were already talking about the aging population and what was going to happen to Social Security. It used to be there was thousands and thousands of workers to support the aging population who were turning 65 and getting on Social Security, and how that trend was going to go upside down. The aging population was going to boom, and there were not going to be enough younger workers to support all those who were drawing Social Security benefits. And we're getting here. We're here now. Yeah.
All of a sudden, everybody's surprised all the baby boomers are wanting to you know, collect Social Security.
Yeah.
The question I have, maybe there isn't a reasonable answer. I never understood why the people who were making the most money, you know, I know an instance where somebody was making, I don't know, for me, a lot of money a year. I mean, it wasn't me doing it, somebody else, $120,000. And all of a sudden in, I don't know if it was July or August of the tax year, that person basically got a pay increase because they quit taking Social Security taxes out. And it seems just the reverse. It would seem that the people, and you know, whether you like it or not, there are a lot of hardworking people in this country still not making enough money for a decent living. So we still make those people pay their I think, what is it, 7.2% now?
Yeah.
Social Security. But then if you're one of the lucky ones making 110,000, you know, you might have 6 months of the year where you don't have to pay. Well,
Yeah.
does anybody, I mean, is anybody else upset about that?
Well, yes. I think a lot of people are upset about that because the people who need it the most aren't getting what they need. You know, and so this doesn't go, in my opinion, doesn't go long, you know, high enough. I think it, you know,
Yeah.
it needs to be higher than that, but, you know, we have to take it
People are making
incrementally.
$250,000 today. I know some of the younger, the generation behind me, I mean, I'm amazed at what I think some of the people are making, and by gosh, they ought to keep paying Social Security.
Right, right.
So where do you, well, I guess it's called a congressperson when that kind of thing.
Absolutely, and you know that's one of the things you don't realize how powerful just making a phone call is, because that's recorded, you know, and there will be things that change based upon how many people call and what they're saying, and you know, and if that's something that they really want, they're going to pay attention to that, and the challenge is to just keep doing it, and it's a shame that it takes that much to get through to your legislator. But that's kind of the way it is right now. So I think, you know, yeah, we want to have this that as many people that need this can have what they want and have good lives. You know, there's no reason that should be such disparity. You know, we just did a forum on income disparity in this country, and it's tremendous, and it's getting worse. And it's another one of those ones like, oh yeah, we're going to have to, you know, do something about the Social Security system sometime. Well, sometime is here. And the problem with income disparity is also here. So that's a whole other, you know, much larger issue that needs a lot of conversation. What do you think about, you know, they always talk about changing the age, you know, a little bit higher for people to start their Social Security benefits. What's the consensus about that? How do you feel about
That's
that?
already started.
Yeah.
My retirement age is 67 3/4. So,
Yeah.
that's
Is
a
that
long
for full
time to
retirement?
work.
Is that for full retirement?
For my full benefit.
Yeah.
It's high enough.
Yeah, and I think you know that's my belief too. Is that, you know, we work really hard, you know, and a lot of people work really hard and they don't have much of an income to begin with, and you know, we know that if we don't have good health care, which we don't have in this district, we know that when we don't have our basic needs met, when our hospitals are closing, when, you know, when our schools are shutting down to 4 days, we know that we're not getting the resources that we need. And so because of that, it's going to be harder on our bodies. It's going to be harder on our emotional ability to just live in the world. And so, you know, I think if we stretch that out too much, we're really being cheated. You know, that's one of the things, you know, when you know, people complain about, oh, look at all the benefits that unions get. You know what? They work really hard, and their bodies are pretty damn beat up by the time that they're ready to retire. You look at teachers, you know, oh, they shouldn't have have an early retirement. Well, you know, they took a lot less pay to put money into a pension so that they could have a retirement, because I'll tell you, at 30 years, people are pretty burned out. So I think we have to be careful about increasing that, because, you know, we need to have some downtime, and we don't want to be working at Walmart as a greeter to make ends meet. As much as people sometimes like that, you know, we need to just have downtime.
Yes, ma'am.
I heard a rumor that the Iron County Hospital was going to be closing. Kathy, did you hear that?
Right now, the last that I heard, we had a forum down in Iron County, and we had the hospital administrator was there. And apparently it's just teetering on being balanced right now. They didn't want to get into the details of it because there was some sort of a deal that was being negotiated among some of the parties, and apparently I think their lawyer told them to keep their mouths shut until it was a done deal. So it's always precarious, and as you know, so many other hospitals have been closed. And, that's the thing that, when I looked at this in the beginning, when I was thinking about running for office, I looked at this district and I thought, when you look at the deprivation in this district, it's pretty intense. And there's so much that this district needs. And there's so much that this district has to give people in terms of the beauty of some of the places. And, we love where we live, but it's got problems. And it's time that somebody starts addressing them. I think that, the first thing is healthcare. That's what we hear everywhere we go, is we want to talk about healthcare. That's our biggest concern.
Any other audience questions? Yes, sir.
I don't know how it's raised it, maybe I'm phrasing it wrong, but if you look at nursing homes that are in relationship with Medicare patients and those that are on Medicaid, what's the ratio, or what's the number of people that you're surveying, and how is it different in relationship with Medicare, Medicaid?
I would say that at any given time, you don't necessarily count Medicare because that's just a benefit for a short time. And depending on the size of a facility or their location, you can have anywhere from one Medicare patient to 20 or 25 at a time, It just depends on how many beds your facility is. But private pay people are people with long-term care insurance, and Medicaid people, it increases every year. Back when I first started as administrator, maybe a fourth of the population was what Medicaid, and the rest were private pay, at least for a fairly long period of time. In probably the last 3 years, it's about 50-50. 50 private pay clients, another 50% that are on Medicaid.
Other questions? Yes, ma'am.
I'm past the age of retirement. I have been sort of semi-retired, I guess, for several years, mainly because I couldn't find work the last few years. And I blamed it on my age. And I don't know if that's true or not, but I'm wondering if I wanted to go back to work now, would I still be able to get my benefits, or at least part of them? I don't know if I would go back.
I think that the biggest loss of benefits is if you take your benefits like early, with the first round, you're limited to a certain amount that you can make. But I really am not sure. I'll find that information out if there's any penalty for that. I kind of don't think so.
Well, there used to be a ceiling, you could make, I don't know what it was, a certain amount, but now I would expect it's changed.
Yeah,
since
yeah.
then.
Yeah, we'll check into that, right?
Thank you.
Other audience questions right now? No. We kind of touched on this with the previous question, jumping back from, say, legislation to, the question is, my parents passed away in a nursing home and their Social Security benefits did not begin to cover their costs. If this happens to me, how can I be sure a local nursing home will have enough Medicaid beds so I can stay in this area? Also, is there anything I can do to protect my family home so that my kids get it?
Most facilities, I can't speak for every facility, but most facilities have all of their beds licensed as Medicare and Medicaid beds. There's several reasons for that. One is you don't want the general population to know if you're a Medicaid client versus a private pay client versus a Medicare client. We try to keep payment source, the people that need to know it for billing and things like that, and nursing for, you often get their drugs in a different place if they're on Medicare versus Medicaid, they choose their own, that kind of, so you have to know those things to run the business. But I do know back in the day, way long ago, we only at, like, the care center had like 6 Medicare beds certified at the time. And kind of what we run into was displacement. You know, somebody'd be in the same room for a long time and weren't going to be able to rehab home, and then we'd have to move them out of that bed to a new room, you know, and that's very devastating if you're used to a certain place in a facility to have to move. And so as Medicare and rehab to home got to be a much more popular thing, then we just certified all of our beds, and most facilities do. There are some that just accept private pay. In the city, you can probably find a wide variety, but here locally, both beds, a bed's certified dually for that. What was the other part of the question? Did I answer that? Yes, protecting assets. You have to start doing that very, very early to protect things from Medicaid, because there's look-back periods on everything. I know there's a lot of families that do trusts many years prior to the possibility of their family member coming into a facility. And I think that usually works pretty well,
See an
putting things in
attorney.
a trust.
See an attorney.
See an attorney, yes, yes.
Yeah, I definitely agree with that. That's one of the things that my dad used to always preach about was, you know, having a trust. It, you know, keeps you out of probate for one thing, and you know, it protects your assets. And you know, one of the things that he did when he retired is that he said, you know, I believe in trust so much that he said, I'm going to, you know, offer that as a service to people free. And so he, over the years, had a lot of elderly folks that wanted to have a trust made, and he did that. And so when he died, all of a sudden we had all of these elderly ladies that were lined up outside the funeral home, and they came in and they started talking. They said, your dad was a saint. My husband died, and I have my home, and I'm okay, and we have our assets. And so they would all go through, but it actually, that's something to really look at. And you know, they don't cost a fortune to get a trust done. And if an attorney's gonna, you know, ask a fortune for it, then find another one. There are a lot of them out there. But that's definitely a way to secure things.
Any audience questions? All right, then we'll jump back to a little bit of legislative question. And I've got this 2 or 3 times here, but this one fits perfectly because this person's about my age. Will Social Security still be available when I turn 65 in the year 2035?
It would be solvent through the end of the century. And then they'd have to do something more about it. But hopefully, if we can see that instead of, you know, being very short-sighted about any of these things, that it's more long-sighted and it really looks toward the future and looks toward our children and our children's children, so they don't have to worry about it. And so we have to act. We have to act as soon as possible. Yeah.
Kathy, I called Congressman Larson, the Connecticut congressman.
Yes.
Who put this forth, this bill, and they have 208 co-sponsors. They only need 10 more to get it out of the House.
Yep.
And so we really need to call Jason Smith,
Yep.
call our state people, and also Jason, the national, and senators too, because
Yes.
it's going to go from the House to the Senate. But first we got to get the House, and it's on its way.
Exactly. And I think I would say call that trio. Call your senators and Jason, because you want to put your senators on alert that this is a problem, we know what's going on here, and we want it to start moving so that it doesn't just stop dead when Mitch McConnell says it stops dead. So, yeah.
Other audience questions? Yes, sir.
Maybe so I can share a little more, expand on this. somehow or another, people need to really come across with the idea that an immigration solution needs to come up, needs to be solved. It's a problem here. Because if you look at the population, you know, when I did a little research on Social Security, the number of birth rates have been declining, and that's, so the only way that you can get people in is to bring in immigrants or the ones that are here. And I'm not sure how many of them are paying taxes right now in regard to working. I know some pay taxes if they're here legally, but there needs to be a fix to this immigration problem for many reasons.
Yeah, I agree with you about that. I think that, you know, again, you know, it's another example of something that's been, you know, we've kicked the can down the road with immigration policy and not had a good solid one that we need. So it's another to-do thing that it's time to do it, because you're right. You know, things would dramatically change if we had a population that was continuing to pay taxes. I mean, that's absolutely correct.
Yes, ma'am.
I would like to disagree with those opinions, because most of the people who immigrate to this country, whether they come in legally or illegally, are coming here to work. And when they work and they're illegals, they're earning a benefit, and a lot of times under a false Social Security number. But those people that are working, whether they're legal or illegal, are for the most part paying taxes in, but not getting any of the benefits or protections that other workers get.
Yeah. Yeah.
So, back a little bit, we talked about the Social Security 2100 Act. Kathy, what policies could be enacted to help people on disability that only get a few $100s a month?
Well, I think that with disability, it's been made so complex that you have to go through so many hoops to get even the bare minimum. And I think that we need to reform the way that is done. The other problem is, you know, I talked about the significance of having a psychiatrist. We are in dire straits in this country about having physicians who are qualified to treat mental health disabilities and things like that, and can actually stand as that person who gets the benefits for that individual. So we need to figure out a way that we can encourage people to be physicians. And one of the things that I think is really an important thing to think about is how can we, for example, if there are 3,000 physicians every year that graduate from medical school who don't have a match, which means that they don't have a place that they can go to do a residency. So what are we doing with them? Well, they can kind of go and get maybe a master's degree in something and then try again to get those connections. And ultimately, sometimes people just quit. So we've got 3,000 people there. We have community health centers, certainly in the 8th District and throughout Missouri, that are begging for physicians. Any child psychiatrist starts out of medical school with a minimum of $500,000. There is no public facility that can afford to do that. But can we begin to take those medical students that don't get a match, and it may not be because, you know, there's something wrong with their educational abilities or their knowledge or whatever, it's just that they didn't get a match, somebody else did. Can we put them in these facilities where they can get some payback to pay down their incredible debt? That's one of the big issues that we have, is we're going to really run out of a lot of physicians because, you know, they're going to go to the places that are going to pay more. They're not going to get what they need in terms of an education in the areas that have the most need, and that's in the rural areas. So, you know, I think that's one thing that we can take a look at as to how we can remedy some of these problems. Yes, ma'am.
And because they owe so much money on their student debt, they all go to be specialists instead of primary physicians.
Right, right. My niece is in her 4th year of medical school, and she wants to be an OBGYN. God love her, she wants to deliver babies in the middle of the night. But she, you know, she's going through that, oh my gosh, what if I don't get a match? Then I'm not going to get to do what I wanted. And of course, OBGYN is one of the most empty fields in terms of people going into that because the malpractice is so high.
Right.
You know, if you work for a community health center, your malpractice is covered. If you're an OBGYN, you don't have to pay the $25,000, $30,000 a year for malpractice insurance. It's covered. So, you know, there are certain benefits, and we need to really, you know, press people about how we can get the word out that, hey, you know, there are places for these docs that can, you know, they can really benefit from it and start to get that paid down. Same thing with dental care. Dentists are reimbursed for going to rural areas and working for 2 years. They get about $50,000 to pay down their debt in that time period. And so that's a good program because it's benefiting all of us.
Any audience questions? No? Okay, this one's from the audience. Is there any advantage to electing to draw Social Security benefits at the earliest eligibility date?
I contemplate that every day. From what I have been able to determine, the longer that you can wait to get your benefits, the better off you're going to be. And so, you know, I think that the challenge is to figure out, you know, how you're going to live the way that you want to live until such time as you can get those benefits. And so, you know, if you start taking them at 62 or 66, I think I'm at 66 and a half, I'm in that age group. And, you know, you really want to think about it carefully. If you want to just have the money that you need and you have extra resources, then great. Go for it. Go as early as you want to. But I think just to be prudent, you probably want to put it off as long as possible.
I think that having no debt when you retire makes a huge difference. It's the only way I was able to do it. And I did it at 62. I think maybe 61.
It's all about health insurance.
I retired at 62, but I did the math on it, and to wait till I was 65, it would have taken 11 years of me retiring at 62, 11 years to get to break even from my retirement at 65. Now, everybody has their own situations as far as money and stuff like that goes, but I have just had 3 classmates in just the last year that become gravely ill or passed away, and they did it within the first 5 years of their retirement. And some of them were 62, some wait till they're 63, some were 65. But if you look at your finances as you're going in, and you start thinking about that 11 years where you don't break even, that's 11 years you get, or at least I get, I think.
Yeah.
That I can do what I want or work where I want for those time periods. So.
Yeah, and you know, that's a good point, because, you know, I think all of our circumstances are so different, and, you know, sometimes, you know, what the most important thing we can do is working, because that gives us some value. And some people are like, hey, I have done it. You know, it's my time now. I'm gonna do whatever I want to do. And I think everything has validity, and it's just, you know, looking at all of the information that you did and finding out this is what works for me. So I think, yeah, that brings up an important point. Thank you.
Yes.
This question is for Kathy. This goes back to the immigration issue. I'm the representative for the Carpenters Union, and we fight daily undocumented worker problems on the job sites. I don't think that that's really the heart of the issue. I think that misclassification of workers and tax fraud from the employer is a much bigger issue. I think that they all would want to pay taxes if they could.
Yes.
But they're not able to. One of our requirements to be in the union is to be an American citizen, and because they're undocumented, we can't sign it. I'm wondering if there's legislation going forward to try to fight tax fraud and worker misclassifications. When you give them a 1099, the employer doesn't pay Social Security in on them, and they're left to do it themselves, and states are just losing billions of dollars a
Right,
year.
right. Yeah, I'm aware that there are some voices that are beginning to see that as a problem, which they should have seen a long time ago. But yeah, that's something that I think you really need to pay attention to, because, you know, you're right, people want to work and they want to pay taxes, they want to be a part of this. We also have to create a pathway to citizenship for people so that we can get these resources of people to work. I mean, because I know that, you know, one of the things that I've talked with a lot of union folks about is it's really hard to get people that will go through the training program and stay with it. I think what the reality is, I think a lot of people that are immigrants would stay and would work and would be very glad to have that.
Any audience questions? Here is another submitted, a little more specific by the audience. Under what circumstances is a Medicare Advantage plan better than a traditional Medicare supplement plan? We may have touched on that a little bit. And is there a rural clinic in St. Genevieve County?
I can answer the second one. There should be, I believe it's 29 clinics throughout the 8th district. And what we are required to have it's a federally qualified health center system. And what we're required to do is that anyone should be able to access care even if they don't have any money. That's a stipulation that the federal government says. That's our responsibility. So in St. Gen, I'm not sure where that is and what the name of it is, but I know if you move closer up into Jefferson County, that is Comtree. And we have about 16 sites throughout Jefferson County and down into, I believe we have a center that works with St. Gen area for a lot of domestic violence as well as children who've been abused. So they are there. There are some in Cape, and they are different sites that provide different services. Like you might have dental in one area, you might have, primary care in another. What we're looking at, what we've done in Jefferson County, is we have created comprehensive health centers. And in 4 of our school districts, we have primary care, dental care, behavioral health, and drug and alcohol services. So that the kids can just go down the hall and get whatever services that they need. And in the later part of the day, it's open to the rest of the community. So that's a model that is, I think, ripe for some federal dollars to make sure that we have these resources available, and there's no reason it can't go in schools. And the schools are more than happy to get it because they've usually got extra space that's not being used, and they don't want to lose the revenue from that kid going someplace else during the day and then losing that for the school. So we do have those. I can get a copy of a piece of paper that I've got that's got those listed throughout the entire district. So let me know at the end of this, and I can get that to you.
As a follow-up, I don't know how long this has been in effect in the schools, the doctors, the dental care. Has it been long enough to do any studies that show the benefits of programs, i.e. lower absences from school, better, it's hard to measure this, but better grades maybe, because maybe kids whose teeth quit aching do better. Have there been any studies showing the benefit of this kind of program?
Yeah, there have been a lot of stakeholders that have done the studies for this in Jefferson County. And what we're doing, it's a relatively new thing. It's been about 3 years, so it's still in that process. But Missouri Primary Care is the parent organization of those, and it has all of the data about what we're doing in the schools and what the impact is. So you might want to just go to Missouri Primary Care and they can pretty much give you that information.
What was that name again?
Missouri Primary Care Association, and they oversee all of the clinics in the state. Okay, so there was another question at the end, and I wanted to say something, I can't remember what it was. From you.
For me?
Yeah, you said something, and I wanted to.
Well, there's one question. I think most people here know the answer. It's not related to this one. It's out of order. But it bothers me that some people refer to Social Security as the impression is that we're freeloaders, or that it's an entitlement program, or that it's the reason we have such a huge federal deficit. I know that's not true, but I suspect one of you can answer that better than I can.
Yeah, it's, you know, that's something that everybody talks about, and you know, of course, with everything there are going to be abuses. But the reality of it is, it's a benefit that we have paid into, and many people over many years have paid into it, and we deserve to have the benefit of that when we start retiring. And so there are a lot of different things in the federal government that are sucking a lot of money. And when we're talking about the well-being of humans in our country, this is a priority. This is a priority because by the time that we're taking Social Security, we have contributed so much to the success of our communities, to the success of our families, to the success of our countries. And so this is something that, you know, that we have earned. And anybody that says it's an entitlement, that is not the correct way to say it. It's a benefit, and it's a benefit that's been hard-won and hard-earned.
So what they call the entitlement reform, they're talking cutting benefits.
Chop, chop. You better believe it. You better believe it. Actually, I was just reading a little piece of information, if I can find it here someplace. Something like 485 billion, no, must have been billion, I don't know, because they were talking about trillions, but I'll dig around here and find it, get that information, is going to be cut from Medicare in the next budget that's being proposed. So guess what? That's us. So we have a lot of complaining that we need to do about what's being allocated, where it's going, how it's being spent, and why aren't we taking care of people with this? Yes?
Will services be cut, or will the doctors be paid less? How's that cut gonna work?
It's a good question. This was just a sort of a headline piece that I saw that came through, so.
SNAP is one of the things that's on the line for the
Yes,
elderly.
very much so. Yeah, yeah.
Which is food, you know.
Stephanie, I didn't know if you wanted to tackle that first question. Under what circumstances is a Medicare Advantage plan better than a traditional Medicare and supplement plan?
I really can't answer it for a person who's healthy and living in the community. I could say a managed care program over regular Medicare and a supplement is much cheaper. And if you're very healthy, it probably is wonderful. As related to the nursing home though, probably the biggest problem is being kicked out earlier than maybe you would originally get to stay for your rehab services to get healthy enough to go home safely. They usually, depending on the condition of the patient, we usually keep somebody in rehab 20 to 60 days. The managed care want them out in 20 days, almost always. So if and we don't get to determine, and you don't get to determine when you're ready. There are people that look at your record, doctors and nurses, I guess, say, good enough, she has to go.
Is that with the Advantage care?
With managed cares and HMOs.
So basically that means the insurance companies
Right.
decide.
The insurance companies.
That's something I think a lot of people don't realize, and I've gone through that with two close family members, and yes, they do decide when you've been in the hospital long enough.
Mhm.
Yeah.
Mary Jo, do you have a follow-up?
Well, unless this has changed, I had a lot of people that were on an Advantage care, and the problem with it was we had to finally give them up because you were very limited as to who you could use.
Mhm.
At
The network,
one
yeah, the
point,
network.
yes, at one point, Mercy or they at different GMH, they were not taking it. They would nothing to do with it unless that's changed, I don't know. So if you look into Advantage Care, you have to really make sure that where you go, they will cover. That's the only thing that I found that's.
I can, at our facility, if we don't take the coverage, we try to negotiate a contract if we don't have it. Sometimes they won't come into our area though, anyway. Sometimes they'll just do a one-time contract for that patient. That's happened before, but, yeah.
Well, I think that, I don't know if anybody's down here has seen Ed Weisbart do his little thing on, Medicare for All. I think that question was asked in one of the times that I saw him, and he said stay away from the Advantage plan. So I think he was pretty adamant about that. He said that's not what you want. So yeah, just a piece of information. The other thing that I was thinking about, community health centers are they operate a little bit differently, and this is one of the things that I like about them, is that 51% of the board need to be consumers of the clinic's services. So I am on the board and I get my dental care from my community health center. And so I go in and I sit in the waiting room like everybody else, and I wait my turn and I get the same, what everybody else gets. And it's a wonderful way to make sure that what is happening is the right thing. So I can be sitting in there, and if somebody's not doing what they need to do in terms of how we treat one of the patients, then that's something that I've observed. So we have all of our board members that are a part of that 51% can actually keep a much closer eye on things and try to correct problems as they occur rather than let them build up. So I'm a very strong advocate of community health centers. I've seen what they have done. I've been in a dental clinic with a young man who was just in another chair down the way, and he had never been to a dentist before. He was about 13 years old. And so they did the little thing where they put the pink stuff in your mouth to show you where you don't brush just right, and they taught him how to brush his teeth. And they gave him his toothbrush, and they gave him his toothpaste, and they gave him his mouthwash, and he learned how to do that for the first time. And he had, teeth needed a little bit of help, but he was ready to come back the next time because he liked what he saw. And so, those kinds of things happen with people who just haven't had any opportunities before. And so I'm very, very pleased to be a part of that system. And, I'm also very much of an opponent of all of the special perks that Congress gets for health care. They have the best health care system in the world. And what I say is we all should have the same one.
One more. Any audience questions? Yes, ma'am.
Well, I just wanted to point out that there is a rural community health center in Farmington that also has a dental clinic there, and they do take patients from St. Genevieve because I go there. So.
Yeah, they take him in
Great
Jefferson
Minds
County.
Healthcare. Okay.
Yeah, they take him in Jefferson County.
Yeah.
Other? Yes, Lisa.
I'd like to make a comment towards Kathy. When you're out there in Washington, you can work on this. As you become old, we've got lots of good facilities in St. Genevieve for people to go into, but short of, I am so sick and I can't take care of myself and I need to be there, we need more in-home services that really allow people to stay in homes and address just the fact that you're old and frail and need some help or a little assistance here and there.
Yeah,
And
absolutely.
it would be a great money saver in the end.
It really would. And so many, from mental illnesses or emotional illnesses and physical illnesses, so much is about people are lonely. And when you've got a good healthcare provider that's going there and they're getting their needs met, Meals on Wheels, those kinds of things make such tremendous difference. And people just want somebody to talk to every once in a while. And so we're dealing with so many things by having that as something we can access. So, I'm totally in agreement with that. We have to really expand that because, we're going to need that stuff too. And we're really going to, want to have our freedom.
But just dollars and cents
Yes,
too, you know?
yes. Yes, well, you know, and so I'm, you know, the thing that concerns me, it's like, you know, we were not a state that wanted Medicaid expansion.
Right.
And so we've left billions of dollars on the table, and we're paying for everybody's health care in the states surrounding us who have.
Amen.
So, you know, it makes no sense to me when you look at, you know, if we want to grow our economy in Missouri, we need to have better health care and access to it. We need to have Medicaid expansion. We need to have schools that are good, and we need to have an infrastructure and transportation, which our unions can provide us with if we let them and pay them and, you know, benefit from that. So we have to really look at all of this tax credit business that we're giving to the richest people is not working. We're suffering for it. And we need to begin to look at what does a strong economy look like. It's when we're healthy. It's when we have our needs met.
Yes, sir.
While you're talking about Medicaid expansion, that's supposed to be on the ballot next November if there's enough petition. I don't know how many people would sign that. Of course, then you always get in, we had, our state representative, Wright come down, and he talked about, well, it's gonna cost considerable bit more money. You know, I'm not for sure what the ratio is in regard to percentage or not, but, I was, you know, a lot of people think, well, if you're gonna expand Medicaid, it's gonna cost me more money. That's the common tax
Right,
rate.
right. I believe that during the first year, if we would have done a Medicaid expansion the first year, the federal government would have taken, it would have paid for 99% of it for about 3 years. Now we've reached that where it's down to 94%. So a little bit more, but
But the benefits,
yeah.
so, and the reason why I bring that up and is the fact, if you haven't signed that petition, I'm not sure there's enough signatures on it yet, have it placed on the ballot.
Well, if Dennis is still out there, he's got all of those, he's got those petitions, and I know that he's with us quite frequently on our journeys, so we're getting a lot of signatures on it, so, I think that it is expected to, be successful, is from what I've heard.
I would like to, I know that, you hear a lot on the news and on talk shows and stuff, but it would be great for every old person to get to live at home. But they're always saying that the cost of in-home care is much less expensive than the cost of nursing home care, and that is not true. If you break down our private pay rate, it's $7 an hour at this point. You cannot pay you'd have to pay privately one person at least $7 an hour for 24-hour care. That's not a nurse, that's not a med tech, that's not a doctor, that's not any of the specialty service and therapy that we provide. So it's really a fallacy that it's cheaper. Only if you need somebody for a couple hours a day and then a family member
Yeah.
or somebody
Right.
free.
And that's really what I mean, Stephanie.
Yeah.
Just supportive care that would allow you to live longer in your home setting.
Right, and in-home services is only covered by Medicaid.
Yeah.
So if you have to pay for it out of pocket, if you're a private, it's very expensive.
Yeah,
Yeah.
Well, we're nearing the end of our session, so I think we're going to wrap up with one more legislative-related question. And that is, we've talked about it a little bit tonight, the Social Security 2100 Act. Kathy, first of all, I would say, I think we all probably know the answer to this, but what is our current representative and senators supporting in Congress and in the Senate, and what policies would you support regarding Social Security?
Well, I think we have to think about expanding it rather than getting rid of it. I'm certainly opposed to any privatization. I think that's one of the things that he's talked a lot about as being an important thing to do. I think that it's what I've done all my career. I'm somebody that's been involved with people who've been dealing with mental health issues as well as physical issues, and just something that I feel is the most important thing that we need to deal with. Unfortunately, I don't think he believes that. Because he made a statement, something to the effect that if people get sick, then it's their own fault and they need to take care of it themselves. So I don't have that same view.
Any other audience questions? Would you like to make some closing comments?
Well, I really appreciate you coming out tonight. This is a way that, I don't know all this stuff. I know a lot about some things, but, when you're looking at running for office, you have to take in the information of the people that are in your district. And so it's really important for me to hear what you have to say, much more so than what I have to say. So, thank you for being here tonight, and thank you for your questions. If you've got any other questions for me that you would really like to find some information for you, I would be glad to do that. And, so I just think it's wonderful that you're here and that you're engaged like this. And I want to thank Elaine, and I want to thank Joan for kind of being railroading us into this. And because you've done a great job, and much appreciated. And
Kathy,
yes.
we had a committee, and we didn't do this alone, so I just
Okay,
want you to
okay,
know that.
right.
And most of them are here tonight.
Thank you for being here. Who's in our committee?
Well, Lisa and Mary and Willis. Susie couldn't make it tonight. She wasn't on the committee, but she was instrumental. David, of course, is like our something or other. Anchor? I don't know.
So thank you so much for that, because this is very important in a lot of ways. If you have any questions for me at any point in time, you can reach me on my cell phone, and my telephone number is 314-265-1924.
Yep, Mr. Smith's cell phone number.
So anyway, thank you for being here tonight.
I know the last question that he asked was, policies and legislation that you're supporting. And if you are people that like to talk to your senators and government officials, one thing that Missouri Healthcare and American Healthcare have been lobbying for a long time is eliminating the 3 midnight hospital stay as part of the requirement to use your Medicare benefit in long-term care. And we support it wholeheartedly. So many times, a person will go to the ER, there's maybe something wrong, they'll keep them in observation, maybe 2 or 3 days, and then we get the call that they need placement, and the family doesn't even know that it's just been an observation stay. I don't know how it's legal that hospitals do this and not put them in an actual room in an acute stay. I had a client one time whose mother was in the hospital for 11 days under observation.
In the ER.
No, they moved her to a room, but she was still in observation. And so when they call and says, they're discharging mom, can we bring her? I'm like, yeah. And so we called to make, how long has she been there? She had her 3 minutes. Yeah, she's been here 11 days. I'm like, oh, no problem. Then we call and check, and they were all observation. I said, you go straight to that doctor and say you better make 3 of those acute stay days. So it's something to be aware of, and it doesn't matter if they're in observation, if you're in the hospital, or even keep the 3 days, but if you're in the hospital under observation or acute, you obviously needed to be there, and then probably need some help after that. So work on that with your lobbyists, and thank you for having me.
I just want to thank you for being here, because, you are a font of information that I will call upon. So thank you so much. Thanks so much.
Thank you all for attending. Have a good night.